Welcome to Ararat Healthcare and Charkos Learning Centre, your one-stop solution for IELTS, OET, CBT and OSCE training, as well as recruitment to achieve your dream to be a registered nurse in the UK. To enhance your chances of passing your OSCE on the first attempt, please visit our website on www.charkoslearningcentre.com to register and book our unique OSCE portal consisting of videos, reading material and quizzes. This registration not only gives you access to the portal, you will also receive 5 complimentary online classroom-style sessions and a mock OSCE test. So don't delay your achieving your dreams any longer and sign up now. There are 2 additional parts for this station. It's the actual drug administration, so you need to be stating that you've confirmed all the rights of drug administration. Is it a valid prescription? Do you have the right patient, the right route, the right medication? Is it the right time? Make sure you're verbalising all of the 5 rights clearly before you go through. Explain to the patient about the sites of IM administration and making sure that they rotate. So make sure that they ask if they have had one recently and where it was given, making sure you give the correct advice there. So the actual process, very simple, but making sure that you dispose of the needles afterwards safely. So sharps management is another key aspect to this. So drug administration, sharps management, the actual process of giving the IM injection itself. Have a look at whether it's a community setting or a hospital setting and make sure that you're giving a due consideration to that. Entering the room, checking for scene safety, making sure it's safe to approach. Before I do, I'm going to do my hand hygiene. Palm to palm, palm to back, fingers interlaced, fingers interlocked, rotation of the tips of the fingers, rotation of the thumbs, and finally rotation of the wrist. Good morning.
Good morning.
My name's Julie. I'm one of the nurses coming here today to give you an injection. Was you expecting me?
Oh yes, I was.
Oh good, that's always a relief. Can I just double check your name, make sure I've got the right patient, please?
Okay.
Can you tell me your full name and date of birth?
Yeah, my name is Frederick Goldsmith and my date of birth is 24th of December 1934.
Oh, you're a Christmas baby.
I am.
And could you please tell me the name of your GP?
I think it is Dr. Thorne.
Okay, and you've just recently moved to Kings Hill residential home here, is that right?
Yes, I have.
Okay, so I've definitely got the right patient. So what can I call you?
You can call me Fred.
Okay, Fred. So as you know, I've come here to give you an injection now. I understand this is going to be the first injection of a course that you need to have for the next 2 weeks, is that right?
Yes, it is.
As the name suggests, Fred, it's going into a muscle, so we need to go somewhere where there is some muscle. So normally the top of your arm or maybe your thigh or your bottom would be ideal places. Do you have any preference where you would like to have this?
No, but maybe you can go in my arm if that is possible.
Of course, yeah. And it's probably one of the easier ones there, okay?
Okay.
Can I just double check, do you have any allergies at all?
No, I'm not allergic to anything.
Okay, super. This is going to take about 10-15 minutes. Is now a convenient time to do that?
Yeah, it should be fine.
Did you need to use the washroom or anything whilst I'm getting the equipment ready?
No, I'm fine.
Okay, so you've got a call bell there, Fred, so if you need anything at all, just give us a shout and I'm just going to go over here and get the injection ready. Is that okay?
Okay.
So I'm going to do my hand hygiene. If there was a sink available, I would do a full soap and water wash, but as not, I'm going to use a hand gel just to make sure my hands are clean before grabbing my apron. Okay, so I have on a clean pair of gloves and apron, and I'm going to clean the tray that I'm going to use for the injection. So I'm going to use 70% alcohol wipe, checking the expiry date, and I'm going to clean the tray, which has already been washed with soap and water in the last 24 hours, so I'm just wiping with the alcohol wipe at this time, making sure that it's clean. So I will dispose of the gloves and apron. And do my hand hygiene. I'm going to need a sharps box which has been assembled and signed, and making sure that it's not over full. This one's fine. I will need a blunt drawing needle which is intact and in date, October 25. I will need either a 21 or 23 gauge needle. I'm going to use a 23 because Fred is ever so slight, so we're going to use smaller size needle there, and it's in date and it's intact. And I need a 1 or 2 ml syringe. I've got a 2 ml syringe here, and the expiry date is 10/25, so that's fine, that's in date. I'm going to need 2 wipes, which are intact and in date, and some gauze. What I will do before I start is do a 5 rights of medication check. I've already checked with the patient. I know I've got the right patient. So we have here Frederick Goldsmith, date of birth 24th of the 12th, 1934, and Fred doesn't have any allergies. And today he is having hydroxycobalamin IM. He's to have 1 milligram in 1 meal, and he is to have it today, every other day for the next 2 weeks, and this will be Fred's first dose. Okay, so hydroxycobalamin 1 milligram per mil, 20 milligrams in the vial. Batch is 2468, expires 06/24. So I have the right medication here. Okay, so I'm going to place that in my tray, and I am going to put on a clean pair of gloves. Okay, so opening my syringe using a non-touch technique, not touching the tip. I'm going to do the same for the needle. Making sure that is now attached. Okay, going to make sure that I've got the opening. Okay, so with the glass vial, I am going to clean the opening with a stirret for 30 seconds and allowing it to dry for 30 seconds. With a piece of gauze, I am going to snap the vial off and dispose of it directly into the Charkos container. Okay, taking my needle and syringe, I am going to draw up 1 ml of the medication. Now I'm going to put my vial back into my tray because I'm going to need to make a note of the batch number, and I am going to sheath my needle using the single scoop mechanism so that I can make sure that I have got enough and that there's no air bubbles or anything in my syringe. Okay, I am happy with that. I am going to take this needle off and discard it directly into the Charkos bin, and I'm going to open my administering needle and making sure it is fine. I will then show my examiner that I have 1 ml with no air bubbles and I'm ready to give my medication. So I'm going to remove these gloves and do my hand hygiene one more time and take the equipment, the injections, to my patient's bedside. Hi Fred, I'm back.
Hello.
I've got a clean apron ready. So Fred, I'm on your left side, so would it be okay to have a look at your left arm?
Okay.
Okay. Okay, I'm just going to roll your sleeve up. Will it come up? Lovely. Okay. So I'm looking at your site and I'm going to measure where I am going to place the injection. The injection is going to go here. And the injection site is clean, there's no abrasions or swelling, any injuries there at all, so it's safe to use this site. Okay, so I'm going to put on clean pair of gloves. Fred, I'm just going to one last time. Can you please tell me your full name?
Yeah, it's Frederick Goldsmith.
And your date of birth?
It's 24th of 12/19/34.
Perfect. Okay. And you don't have any allergies, is that right?
No.
You ever had a bad reaction to an injection before?
No.
Okay, perfect. So I am going to clean the top of your arm in a circular motion using an alcohol wipe. Okay. And then I am going to take your injection in my dominant hand. I'm left-handed, Fred, so I'm going to hold this in my left. So using my right hand, I am going to stretch your skin. Okay, so I am going to do the injection now, Fred. Okay, I'm going to sharp scratch come in, and here we are. I'm going to inject it at a 90 degrees angle, making sure that there's about approximately 1 centimetre left. I'm going to aspirate, and I'm going to inject slowly, counting to 10. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And I'm going to leave it there for another 10 seconds, Fred. So 1, 2, 3, 4, 5, 7, 8, 9, 10. Now I'm going to withdraw that rapidly and put pressure on there. Using the table, I am going to activate the safety device on there and dispose of that directly into the shark fin. Okay, how's that done, Fred?
Yeah, it was okay.
Not too painful, I hope?
No.
Okay, there's no bleeding. If it was a little bleeding there, I would put a little plaster on there, but there's no bleeding shown at the moment. So I am going to take off my gloves and apron and dispose of those directly in the clinical waste. And I am going to do my hand hygiene. And make sure that you are recovered there, Fred. And now I'm going to sign here immediately. So we've kept the vial because we needed the batch number. So 2468. It is 11:30 hours, and we have given it in the left upper arm. And I'm signing to say it was me, and no problems noted with that. Okay, Fred, that's all done. So you are due another one, not tomorrow, but the next day.
Okay.
Because this is a new thing for you, we don't expect you to have any reaction to it, but should you start feeling a bit flushed or itchy or having difficulty breathing or just feeling unwell in any way, I would like you to let the staff here know, and they can inform the surgery and we can come back and review you, okay?
Okay.
Is there anything I can do for you before I go, Fred?
No, I'm fine, thank
You
you.
sure? Are you comfortable?
Yes, I am.
Okay, in that case I am going to do my hand hygiene and I'm going to take the equipment away, make sure it's cleaned, ready for the next use, and discard it appropriately in the clinical waste as necessary. Okay, I will pull back the curtains so that you can see, Fred. Okay, have a good day.
Thank you.